I can't think of a more important decision that the Regents made in the last 5 years at the health system level than IHPI.
IHPI is both a physical and a virtual community.
An epicenter for innovation and change and transformation in healthcare.
A connector and a facilitator and a convener, as well as a catalyst.
It brings together lots of really, really smart people who are all passionate about improving healthcare and health policy.
There's so much great work going on in so many different areas that I don't even think of, and I could have never appreciated on my own.
The creation of the Institute of Healthcare Policy and Innovation was a huge step forward. The availability of physical space for individuals to come and actually literally be together physically has been an amazingly positive bonus.
Research can often be a siloed field. IHPI has facilitated collaboration by, if not breaking down walls of the silos, poking holes large enough for people to walk through and collaborate.
It takes a multidisciplinary approach to problems of healthcare, and that's essential because these problems are complex.
We know that the best innovation takes place at the intersections of different fields, and IHPI is a place where you can create those intersections. Those intersections kind of happen naturally because of the co-location of all these different groups.
The project that I'm most involved in substantively here at IHPI is the evaluation of Michigan's Medicaid expansion. John has put together a team of people working with the state to evaluate different pieces of that. And that's not something I think that we could have done individually as faculty working in our separate departments.
I was approached about joining a group that will be evaluating the Michigan Medicaid expansion. I never would have had that opportunity without IHPI. That also led to a grant I just recently got from the Agency for Healthcare Research and Quality, and this is a project I've been wanting to do for like 20 years.
We now have what are known as meaningful use criteria, where hospitals actually have to demonstrate how their electronic health records and their communication technology is used. Our study will actually help hospitals do that because they will be provided with information that helps them meet that meaningful use criterion. It's going to have a direct impact on policy.
We recently received a 5-year contract from NIH to do the registry for chronic kidney disease and end-stage renal disease patients. And IHPI played a significant role in us getting that contract. We didn't have to budget for the purchase of certain data sets that IHPI is working on access to through the data core.
Studying the quality of cancer care has been an opportunity to get some information out in front of the public that perhaps people weren't as aware of, and IHPI has been helpful for me in doing that. We were able to publish data and get it out in front of some media channels, and I'm also working with IHPI Impact Accelerator to try to do more of an op-ed piece on that so we can get it out into the public even more.
The Blue Cross Blue Shield funded quality improvement collaboratives are improving care for patients in the state of Michigan, and I know that those efforts are spilling out across the nation now. Some of the work we've done in our bariatric collaborative to prevent blood clots, that's lowered the risk of blood clots in the state, lowered and reduced the death rates, and now other hospitals throughout the nation are adopting our guidelines.
In newborn screening, we want to make sure we get to the children before they become symptomatic. So I've worked with some of the healthcare system engineers at IHPI. Maybe we can make some changes to the way the blood's collected at the bedside. Maybe we can get the pickup at the hospital more frequent. That means we can get the specimen there earlier, and we've saved dollars and saved lives at the same time.
Just look at the last few issues of the New England Journal of Medicine, at least 2 or 3 articles in there from IHPI. When you think of that again and again and again, plus the connections we have around the country, I think it can make a significant impact on helping America get better health.